Hi, my name is Lex Hristova, or Lex. I'm a cognitive behavioral psychotherapist in private practice and a senior lecturer in psychology. Today we will be talking about the case formulation approach to CBT. Cognitive Behavioural Therapy, or CBT for short, has developed over the years into different approaches, and two of the most well-known are formulation-based CBT and protocol-driven CBT. Whilst they both share the same core principles, they're quite different in how they're applied. One is more flexible and tailored to the individual, while the other follows a structured, step-by-step plan based on research-backed protocols. Understanding these differences is important, not just for therapists, but for anyone curious about how CBT works in real-life practice. Formulation-based CBT is all about creating a personalized treatment plan for each patient. Instead of following a strict set of steps, the therapist and patient work together to develop what's called a case formulation. This is basically a roadmap that helps explain why the patient is struggling, what might be maintaining their difficulties, and how therapy can help. It takes into account things like past experiences, underlying beliefs, and patterns of behavior. The idea is that no two people are exactly alike, so therapy should be adapted to fit their unique situation. Now, protocol-driven CBT takes a different approach. Instead of creating a personalized formulation, it follows a structured, evidence-based treatment manual designed for specific disorders. These protocols outline a fixed number of sessions, standardized exercises, and techniques that have been proven effective through research. If someone has depression, for example, they might follow a treatment plan that includes behavioral activation, cognitive restructuring, and relapse prevention, all laid out in a structured plan. This approach works really well for depression and anxiety disorders like post-traumatic stress disorder and obsessive-compulsive disorder, where specific techniques have been shown to produce significant improvements. The formulation approach has its roots in Aaron Beck's early work in the 60s, when he developed cognitive therapy for depression. Back then, he realized that many of his patients had deeply ingrained negative thought patterns that contributed to their distress. As CBT expanded beyond depression to include anxiety, trauma, and other mental health issues, therapists found that not every patient fit neatly into a single diagnostic category. Some had overlapping conditions, long-standing difficulties, or complex histories that didn't align with a one-size-fits-all approach. In the UK, clinical psychologists predominantly use formulation-driven CBT, which is more flexible and individualized and a better fit for more complex difficulties. The reason protocol-driven CBT became so popular is largely due to the need for standardized treatments that could be tested in clinical trials. In the late 20th century, researchers wanted to establish CBT as a scientifically valid therapy, and for that they needed structured interventions that could be applied consistently across different studies. Over time, manualized treatments became the gold standard in clinical research and were widely adopted in healthcare systems worldwide. One of the main differences between these two approaches is flexibility. Formulation CBT allows therapists to adapt their techniques based on what works best for the individual. If a patient's difficulties don't fit into a single diagnosis, the therapist can blend elements from different models, including third-wave CBT approaches like mindfulness-based cognitive therapy or acceptance and commitment therapy. This makes it particularly useful for people with more complex mental health issues, such as personality disorders, trauma histories, or comorbidities with long-term health conditions. Protocol-driven CBT, on the other hand, is designed for efficiency and consistency. It ensures that patients receive a structured, evidence-based intervention that has been thoroughly tested. This approach is especially useful in settings where therapy needs to be delivered in a time-limited way, such as the NHS talking therapy services, where the high demand means therapists often have to work with strict session limits. It also provides a clear framework for newly trained therapists, making it much easier to ensure that treatments are delivered consistently and effectively. But both approaches have their strengths and limitations. Case formulation CBT, while highly tailored to the individual, can take longer and requires therapists to have a high level of skill and experience. This means that treatment can vary depending on the therapist's expertise, which isn't always ideal in large-scale healthcare settings such as the NHS, and much easier in private therapy. However, for patients with more complex needs or patients who are seeking private therapy in a more explorative way, it can be a much more effective approach than simply following a rigid protocol. Protocol-driven CBT, while great for efficiency and reliability, can sometimes feel too structured. Some patients might struggle to engage with a manualized approach, especially if their problems are rooted in early life experiences that require deeper exploration. There's also a risk that a highly structured approach might overlook important personal factors that contribute to someone's difficulties. In real clinical practice, many therapists use a combination of both approaches. They might start with a structured protocol for a specific condition, like for GAD, but then adjust the treatment plan based on the patient's individual needs. This blended approach offers the best of both worlds, evidence-based techniques delivered in a way that feels the most personalized. The choice between formulation and protocol CBT often comes down to the settings in which the therapy is delivered. In research in high-volume clinical services, protocolized CBT is preferred because it's efficient and easy to standardize, and therefore easier to test. In secondary care, specialist services in private practice, formulation CBT is more common because it allows for greater flexibility. At the end of the day, both approaches aim to achieve the same goal, to reduce the stress and improve well-being. The key difference is in how they go about it. One prioritizes structure and consistency, while the other focuses on adaptability and personalization. If you're looking to explore CBT, you shouldn't be put off if you're offered either of those. Therapy is very much about building a relationship with your therapist, which will allow them to gain an understanding of your difficulties so that they can create a helpful treatment plan. And both approaches are an excellent tool for that. Hi, my name is Alexandra Hristova, or Lex. You can find me on Instagram at lex.cbt and on Psychology Today, Lex Hristova. This video was made in collaboration with MindFriend. They're an educational digital platform combating misinformation of mental health through accredited professionals. See you in the next video. Like, comment, and subscribe.